The Mishcon Academy Digital Sessions.
Dr Mark Freestone is a senior lecturer in the Centre of Psychiatry, Queen Mary, University of London. He originally trained as a sociologist and has worked in prisons and forensic mental health for over 15 years as a researcher and a clinician, including in Category A prisons that house some of the UK's most notorious and high-risk criminals. He's also worked at high-security special hospitals as part of the Dangerous and Severe Personality Disorder Programme, which piloted new interventions for men and women in the UK with the diagnosis of psychopathy or severe personality disorder. He was a consultant to Series 1 and 2 of BBC America's Killing Eve and is an editor of the Journal for Forensic Psychiatry and Psychology, and currently an advisor to NHS England on services for men and women with the diagnosis of severe personality disorder. He's published several academic articles on personality disorder, psychopathy, and violence risk. And as if that wasn't enough, Mark is publishing his first book called Making a Psychopath, which is a funny, devastating, at times quite graphic, articulate but very readable account of 7 of the most dangerous minds that Mark has encountered over the last 15 years of his work in prisons. One key aim of his book, he says, is to help humanise psychopaths and help the reader understand why it's so difficult for these men and women to form the kinds of social and emotional relationships we all take for granted. So Mark, welcome. Thank you so much for coming. We're delighted to have you. First of all, please can you help us understand what is the clinical diagnosis of a psychopath? What are some of the clinically recognised psychopathic traits and tendencies, and how are these measured?
I mean, essentially, a psychopath is someone who lacks the ability to reason emotionally in the same way that most of us do, or most of us would take for granted. In terms that are pretty, I suppose, trendy in psychology and psychotherapy at the moment, a psychopath lacks the ability to mentalize. That means that they can't recognize emotions in themselves or in other people and can't understand where those emotions come from. Now, that applies in 2 ways. Literally, if you present a psychopath with a picture of somebody else expressing an emotion, it could be fear, sadness, then they can't recognize that there's an emotion being expressed at all, and certainly can't put a name to it until the expression becomes sort of almost comically distorted. So, anger would have to be sort of, full-blown facial morph. And they're unable to think about the consequences of what would happen if somebody was expressing an emotion. So a corollary of that, because it's the same area of the brain that thinks about emotional reasoning and moral reasoning and risk and reward, they're not very good at making decisions about what is beneficial for them and why. Psychopathy is forever attached to something called, we call colloquially, the psychopath test. So this is the psychopathy checklist revised, created by Dr. Robert Hare in 1993 now. Hasn't changed much since then, perhaps it should do. And it is a checklist that's administered by clinicians, so that's usually psychologists or psychiatrists, but technically anyone who's been trained to do it can do it. So John Ronson, very famously, the British comic writer, undertook the training and went ahead and started diagnosing people in his family in the street with varying degrees of psychopathy. And that it's a checklist, as I said, of 20 questions. But you've got to have 30 points, and each of those items that I put up is worth potentially one, or you can have one on score of 1 or 2. So you need about 15 traits. In the community, most people have none or 1. So you get 1 point. So if you have 30 points in total, you would be classed as a clinical psychopath, which means you'd have the full psychopathic disorder.
Can you talk us through the anatomy of the brain of a psychopath? Is it different from the brain of a non-psychopath? And if it is, how is it different?
I suppose that there's 2 key areas of the brain that are different in a psychopath. As far as we know, there may be others, but this is where research has been focused. The first area is the amygdala, and we think that the amygdala is responsible for emotional processing, right? And it has complex links to the prefrontal and orbital prefrontal cortex. In a psychopath, the emotional processing is poor because their amygdala is smaller, it just has a smaller volume. B, it shows less activation. And thirdly, we think there's actually structural differences in the amygdala, so it doesn't quite have the same properties. It's very difficult to test out these areas of the brain, but when you use contrast tomography or PET scans on a psychopath's brain, the actual patterns of activation in the amygdala are different as well. And the amygdala is linked to other areas of the brain, the There we go, prefrontal and orbital frontal cortex, which is the area at the front of the brain here. So it's not just the individual parts of the brain, it's also the link between them that's really important. And of course, we know that the orbital frontal and prefrontal cortex are involved in moral reasoning and decision making as well.
And so the anatomy of the brain, as you show in these slides, is it that somebody is born with these defects, or can you develop these defects? Can you develop the changes in the anatomy of the brain through various circumstances?
So if you have a child who's experienced very high degrees of neglect, they will show reduced white matter and reduced grey matter right down to the limbic system as well. So if somebody has experienced high degrees of neglect, they will probably have reduced volume and activation in their amygdala and even some of the parts of the limbic system that control movement. So there's studies by Bruce Perry, who's a psychiatrist in the United States, that shows that, you know, kids at the ages of 14, 15 who've been very heavily abused can actually have, you know, reduced motor skills because their development has been so retarded by the experiences that they've had. But he also shows that with exposure to a sort of good enough caring environment and fresh air and conversation, it's surprising how plastic you know, a young man or woman's brain is in terms of getting those things back. So we know that while the environment can cause those same structural problems, in most people they can recover if they're caught early enough. The problem we have with psychopathy in particular is that there's some evidence that some or lack of structure in the amygdala can actually be genetically inherited. We call this something called, it's called callous unemotional traits. So even children who are quite young, sort of 9, 10, 11, 12, you can genetically inherit these callous unemotional traits, and they are very, very linked to the subsequent development of psychopathy. But of course, only about 40% of kids with those traits will develop anything like clinical psychopathy. So it's not clearly a case of you have these genes and you're a psychopath. It's much more nuanced than that.
Is it possible to reverse the damage done to a brain that's a consequence of trauma or some kind of experience? That's
a good question. The first response might be, well, is it necessarily damage? Because a psychopath's brain changes, we think, partly as a result of inherited genetic traits, sure, but also as a result of the environment around them. Now, it could be a very adaptive response. For example, if somebody is very heavily abused or neglected, to be very, very sensitive and very easily sort of traumatized is going to make it much, much, much harder for that person to live a normal life. And there is a lot of psychodynamic theory that suggests, well, psychopathy is a defense against these kind of awful situations, which would then lead us into the question of, well, okay, if it's a defense, can you change it? Can you recover from it? Just throwing people into CBT and hoping for the best isn't going to work ever, ever. And I think that's largely what's been done before. If we think about what exactly affects psychopaths, what's wrong with them, it's something to do with the way that they process emotions that we think is linked to their environment growing up. So something like mentalization-based therapy, where we try and reintroduce those mentalization ideas, try and almost push people to recognize emotions in themselves and others and talk about them, even when it's difficult and they're uncomfortable. If it's more targeted at the exact deficits, behavioral and cognitive deficits that psychopaths have, I think that's much more promising. And I think it's probably more hopeful than we've been for a long time.
So I have two questions on this. The first is the Netherlands-based system, and you speak in your book about your trip over in 2005, and they've taken quite a different view to the ones we have in the UK. It's much more community-based in nature. It's therapeutic, and actually the inpatients have jobs. They run the cafes, they run the restaurants, etc. How helpful do you feel that is in terms of an environment for rehabilitation? And secondly, do you feel that can be translated to our population of psychopaths?
So the big difference between us and the Netherlands is that the Netherlands don't have this obsession with treatment, right? So for them, they use the term risk management. Once you make that distinction, you know that you're not trying to treat, you're trying to manage somebody throughout the rest of their lifespan so that they don't reoffend. Now, it's efficient to manage people out of hospital, right? So at the Van der Herfen Clinic, the intention is to provide care that's efficient. And that means involving people in their own care, which is a fantastic idea, getting to take some ownership for it, some responsibility, and doesn't infantilize in the way that parts of the British system do. Not only that, but you can be economically active. If you're a psychopath, you're oriented in time and place, you don't have psychotic breaks, you might have a very low temper threshold, or you might be inherently given to manipulating the system, sure, but if your system is well enough set up, that should be something that people can deal with. So you can provide people with employment, you can provide them with a full pathway right the way from the point of sentencing to the point of absolute discharge.
Mm-hmm.
And if there's, you know, hiccups along the way, you can go back up the system, you can go
Mm-hmm.
back down the system.
Mm-hmm.
And I think the key point in relation to the Netherlands that we don't have in the UK is that all of that is managed by a single point of contact. It's
Right.
usually the clinic, and we don't have that joined up thinking in the UK. It's just a system of referrals, you know. So if I have a problem with chest pains, then I get referred to a specialist, and he may refer me to someone else, and I may get referred to outpatients. And, you know, that doesn't work terribly well for physical illnesses, but it's dreadful for a psychopath who's experienced this kind of chaotic engagement throughout their entire life. So that crosstalk isn't there yet at the point where we could say this is a system we could deliver in the UK. But I think it's the only answer. And I just wish that we started on this process 10, 15 years ago.
From your perspective, what was it like working with psychopaths day in, day out? What was the effect on your mental health, if at all, of your work?
I think it's a question of who gets under your skin. You know, you talk to 10 clinicians, they'll all have one patient that particularly, you know, gets under their skin and kind of nibbles away at them. And it's really difficult to work out why. And the suspicion is that perhaps it's more about you than it is about them. And that's difficult to accept. I tend to get particularly upset by patients who I start to feel sorry for. I think for other people it varies. So it could be, you know, some people who find very, very psychopathic, very primary psychopathic people who are very aggressive and dominant, very difficult. Other people find sex offenders very, very difficult. And other people find anyone with offences against children very difficult to work with. So what it is that's sort of triggering that difficulty varies a lot.
Yeah, absolutely. The other thing you say about working with psychopaths, a lot of those who suffer with severe personality disorder have this kind of hunger for identity. And clinicians often feel like they have to try and find out what that is so that that person can then look at themselves in the mirror, recognise themselves, and then job done, move on. But often it's not easy like that. A lot of the time you feel like failures, you haven't helped the patient, and everybody is no better off. That must be a very difficult experience from your perspective.
Yeah, I mean, the way you expressed that, Lydia, is really interesting, because actually with forensic mental health, what we're trying to do is make sure they don't come back and offend again. But you get drawn into this, you know, some of the men who would also be diagnosed with a borderline personality disorder as well as psychopathy. So one of the examples in the book is a patient was discovered to have a very serious kidney disorder, to the point where their kidney was going to fail within a couple of years. You know, everyone's like, you need to have a transplant, we can arrange this, we're a hospital, we have good links to the university hospital where the surgery could be done. Everything's arranged, and 2 weeks before, almost, I think it was slightly less than that, the patient decides he doesn't want the kidney transplant. Now this is such a massive middle finger to us as the hospital, but also to his own life, because he is going to be on dialysis for the rest of his life, and he may well die at some point of illness. And all of this felt like it was just being done to sort of spite the system, rather than with any thought to, you know, this man's quality of life or well-being, or even ability to live beyond the very, very short term. So that level of identity dysfunction, like, who am I? What do I want from my life? How can I be happy? For some of these men is so compromised that even, you know, the decision to continue with your life is really, really distorted. And it makes you sort of like, there's no ground truth in this work. There isn't a sort of position which you can say, this is the right thing to do.
Yeah, no, absolutely. And I guess this kind of goes back to a bigger umbrella point, which is the definition of a psychopath lumps a shed load of characters, personalities, traits into a fairly clunky, probably out of date test. The book, I think, is really amazing. It's dispelling the myth that actually psychopaths are Machiavellian, globe-trotting, glamorous assassins, and actually there's a real human there's a real human sadness behind them.
And I'm really glad you took that away. There is a Machiavellian globetrotter in there, just for your, you know, for everyone's delectation. But I was sort of prompted to do this work after consulting on Killing Eve. I mean, the challenge with Villanelle is to try and say, well, this isn't just a person who's defined by being a psychopath. They also have this sort of, you know, archaeology of life experiences and trauma and ideas and frustrations and desires. And that's the thing that we mustn't forget, is that a psychopath is not completely defined by being a psychopath. It's almost like a deficit that they may have, sure, and they can't do things that other people have. And in some cases, because their psychopathy is so developed, they can do things that we can't, like commit horrible crimes with apparently no guilt or remorse. But no psychopath is defined entirely by their psychopathy. That's a bit of a sort of cliche, I guess, that we need to challenge.
Absolutely. So that leaves me to say thank you so much, Mark. We've really enjoyed having you, and thank you very much for all your amazing insight.
You're welcome. It's been a pleasure, Lydia. Thank you so much for having me.
Thank you.
The Mishcon Academy digital sessions. To access advice for businesses that is regularly updated, please visit mishcon.com.